Hi, we're students from the University of Toledo College of Medicine and Life Sciences with the Global Health Elective. Today we're going to be talking about the impact of electives in increasing global health awareness. My name is Dalia Altarshan.
My name is Humza.
My name is Nick Delcimmuto.
And my name is Karim Ibrahim. So a quick background on this elective. It was created in 2017 by UTCOMLS students and faculty to address the student physician's desire for increased global health awareness. The goal of our current elective is to create more well-rounded physicians who are able to connect the local health issues to the global issues at large. In doing so, we are challenging our future physicians to improve upon their cultural competence and apply this kind of thinking when serving local clinics, encouraging them to recognize and become advocates for populations that are underserved.
So the focus of the elective has broadened from its initial purpose as a medical mission primer to encompass a wider range of pertinent topics relevant to the current status of our world. Issues discussed now include the ethics of medical missions, impact of COVID-19, medical student burnout, working with immigrant and refugee populations, and the U.S. prison industrial complex. The elective consists of 8 separate 2-hour sessions with content delivered using a mixture of guest speakers, panels, films, presentations, and small group discussions. Since the elective has started in 2017, 63 students have participated. So this is our current elective schedule of our events. This is last year's schedule. And this is a schedule from the year before. So as you can see, the focus has shifted from just medical missions to a broader global health focus. In order to gauge students' self-rated competency in global health, 2 identical surveys were given to students participating in the elective. First one was given at the beginning of the elective, and the second was given after completion of the elective, and these are the questions that were covered in the survey. And the data showed a statistically significant increase in self-rated competence in global health.
So the data you're looking at right now is from previous years, just there for comparison's sake. So if we move to the next slide, what we're going to see is the data from this past year. And basically you can see that the blue is pre-assessment data and the pink bars are for post-assessment data. And for our data, we asked participants 12 questions that revolved around their ability to understand and discuss the importance of global health and as insight for assessing the social determinants of health for a specific population. Now, the most significant increase was seen in students' competence in global health, and the smallest increase was seen in students' understanding of how they will utilize the medical knowledge for the benefit of public health. Now, our most recent data suggests that student physicians are entering medical school with a higher baseline level of cultural competence. This could be a variety of factors. The pandemic of 2020, coupled with an increase in grassroots advocacy on social media, has allowed students who are interested in discourse on these issues easy access to relevant facts and figures.
So total conclusions from this data. We're finding that a preclinical elective centered on exposing student physicians to global health topics is an effective way to promote the importance of understanding intersectionality in healthcare. The most efficient way to achieve this goal is to use a diverse set of events that ensure that the students remain engaged with the various content. Concurrently, this allows for us to assess that the students who are completing this elective feel confident in applying their knowledge when exposed to issues that weren't covered extensively in the syllabus. The end report is increased student understanding of their roles as advocates for vulnerable populations when they establish their practice in the future as future physicians.
All right, so our plan for the future involves not only continuing of this elective that has been shown to be incredibly effective, but to also incorporate it and into medical missions with the organization SoHope. We also seek to further integrate global health into UTCOMLS medical school curriculum as well. We have added and implemented a new branch to our program that addresses global health disparities in our own local communities.